Today we're going to talk about a less common problem called pain on the outside of your foot. So much of the time people come in and it's the arch pain and heel pain, but people do have symptoms on the other side of the foot. So where do these painful problems come from? When I examine the foot, the first thing I think of is, of course, localizing where the pain is. People think if the pain is over on the side in the back, it's the ankle. Oftentimes, when you actually evaluate it, it's slightly below the ankle. And then we have to distinguish between problems in soft tissue, like tendons, and problems in bone, like the joints. So, what are some of the most common points in pain on the outside of the foot? One of the most common problems on this side of the foot that can plague people is pain under this cube-shaped bone, just in front of the ankle, and underneath. There's actually a trough in this bone because you have a major tendon coming from the outside of the ankle, under here, all the way over to the other side of the arch. And it is very important. It helps us as we walk forward from not spraining the ankle, and it fires to pull us back over the big toe joint. This tendon is called the Peroneal longus tendon, and the syndrome gets called Cuboid Syndrome. You can refer to our website for more information about the Cuboid Syndrome. So you can classify this as a problem with a tendon or tendinitis. Very close by, maybe a close cousin if you will, is pain at the base of this bone right here. This is your fifth metatarsal bone, and you can feel this prominence sticking out of the side of your foot. It's not the most common thing occurring, but the shorter of these peroneal tendons, named Peroneus brevis, didn't take much creativity to name those two, and it inserts right at the point of that bone. And I've seen a few cases even in the last couple of weeks where this over-pulls on the base of this bone and creates pain here. Notice not much distance between there and the bottom of the other bone where we had the cuboid syndrome. But they can be distinguished simply by palpating the foot and feeling where is your point of pain. The third thing is joint pain. Here we have several choices, all the way from the rear part of the foot, under the ankle, to next joint up where the heel bone joins the cuboid bone, and then finally right across the midfoot. Each of these problems is a little different in cause, but if we distinguish which ones they are, we will also sometimes use a local injection of an anesthetic, sometimes with cortisone, to further isolate which joint, and if it's the joint, that's bothering you. X-rays can also be helpful in deciding whether or not there's any degeneration or arthritis in that area. But if those aren't present, we usually are led back to figuring out what mechanically is going wrong with the foot, and then designing supports for you to help minimize this and eliminate pain on the outside of your foot. If you're having problems with pain on the outside of the foot, come on in and let's figure this out together. Get you back to your activities quickly.